Acute myeloid leukemia, or AML, is a blood cancer that can occur at any age, but more commonly affects older patients. The cancer starts from cells in the bone marrow called white blood cells. These cells can acquire a genetic mistake called a mutation that allows them to grow more than the normal cells. There are many mutations that can result in the abnormal growth of these cells. Acute myeloid leukemia is diagnosed by a bone marrow biopsy. This is a procedure that allows us to take a small sample of the bone marrow, usually from the hip area. There are no stages to this cancer since blood is everywhere in our bodies, but some mutations or genetic abnormalities found in the leukemia cells can make this blood cancer either more aggressive or less aggressive. Treatment consists of either chemotherapy or targeted therapy. Treatment usually starts in the hospital and later continues in the clinic. One of the most common risks after diagnosis of acute myeloid leukemia is infections, since the immune system is affected. This occurs because the leukemia cells do not let the healthy cells in the bone marrow grow. Most patients also experience fatigue, and some may experience bleeding. Patients with acute myeloid leukemia often need blood and platelet transfusions because the bone marrow is not able to make enough healthy cells. After the initial treatment, another bone marrow biopsy is performed to ensure the leukemia cells have been effectively killed. Some patients may also be recommended to undergo a bone marrow transplant. In this procedure, chemotherapy is administered to eliminate the bone marrow cells, and bone marrow cells from a donor are transfused into the patient. A bone marrow transplant typically involves staying in the hospital for about a month while the new immune system grows. Clinical trials can also be considered as part of the treatment and can be a good option for many patients with acute myeloid leukemia. Clinical trials usually involve using the therapies that are already available, plus the addition of a new drug that we think could increase the efficacy of our current therapies. If you or a loved one faces an acute myeloid leukemia diagnosis, remember, don't go it alone. Work with an experienced hematologist-oncologist to develop a personalized treatment plan and who will support you and your family through this journey.